So when the fat-derived stem cells are, next to the cancer cells, either in a petri dish or on a live animal's body, in both cases, the cancer just keeps growing, getting bigger and bigger. But if you use umbilical cord-derived stem cells, the cancer just starts shrinking and go away. So this is why I feel there's an obligation for me to provide people with a treatment, not only that's more effective, and because the cells are more potent, but also safer.
It's interesting how the details of the science of the intelligence of the cells needs to take precedence and not just the idea of stem cells as a generality. Hello, everyone, and welcome to the Dr. Joy podcast. I'm so honored to be spending some time with you again to learn more about this cutting edge technology and medicine of stem cell therapy, regenerative medicine, anti-aging medicine, and all the different avenues that we're prolonging life and looking at new ways to treat our healing and our illnesses. So thank you so much for being here with us today, Dr. Joy.
Thank you so much, Chandanni. I really look forward to, really getting some good information out for people again.
Thank you so much. So let's dive right into it. There's this common misconception, not only in America, but I think around the world, that stem cell therapy is actually illegal. Especially here in the US, it seems like there's a lot of controversy around, is it FDA approved? Is it legal? Is it illegal? We've heard that there are stem cell therapy treatments happening around the world. So could you please guide us on the misconception around the legality or illegality of stem cell therapy?
Yeah, absolutely. So that's one of the common myths, and that just keep persisting. It really came from initially stem cells were discovered for embryonic stem cells. So when you realize that these are stem cells, there are stem cells from the embryo. Of course, the very first stem cell is a fertilized egg. So what happened was the researchers were letting the fertilized egg to grow in a process to develop into a fetus, but at only day 5 to 7, they can obtain a cell from this, this ball of cells, and then that cell can become all kinds of tissue in the body. So that was the earliest and quintessential stem cell. But Bush decided to ban stem cell research because of the pro-life philosophy, and they believe that life was destroyed. Right. So by destroying embryo. So that was banned for doing embryonic stem cell, destroying any further embryos. People are still doing research on those embryonic stem cells. So the lines are still, being used, but not any new embryos being destroyed. So, and then you can't give embryonic stem cells to humans unless you're under a clinical study. So you can't just, treat patients. And then there are fetal sources, which some countries do use, famously Ukraine, they use fetal stem cells, and definitely that is not legal in this country. So that was the initial, this legality concerns. A lot of people think, oh my God, that these are the sources of stem cells and they're not legal. But since then, all kinds of stem cells have been discovered in the body. In our adult body, we're full of stem cells. Of course, as we age, they get less and less, but we're still full of stem cells. And then, of course, the birth tissue, which are the placenta and umbilical cord, is, filled with stem cells and much more powerful than the stem cells in our adult body. So you can extract those. So for those cells, it's actually very legal. It's completely legal to use these sources because these are biological waste from healthy live births, right? Usually these tissue would just be tossed in a biological waste basket, but now we know we can process them, get cells out of it. So people are willing to donate. It's still considered human tissue, so the mother has to be willing to donate. So if you are able to process the cells without altering them in any way, which means either using chemicals or enzymes, or growing them into huge numbers in an incubator, then you are producing something that's true to what it was And then if a doctor wants to give it to a person to use these cells to perform similar functions in another human being, that's considered a tissue transplant. It's not that different from blood transfusion or, organ transplantation, the liver transplant, lung transplant. So if you don't alter them, right? So you never hear about, the liver transplant needing FDA approval or other, tendon transplant, every little organ can be transplanted, right? Bones. And so you don't need the FDA approval for that. A doctor can perform these procedures because these are under the purviews of, a doctor's privileges to practice medicine. But if you alter them in any way, if you use those, enzymes and chemicals and grow them into huge numbers, then the FDA says you are creating a drug. And those are the times where it is not legal to use unless you are under a clinical study. So these are called IND studies, investigational new drug. And it's a very cumbersome process. It costs a lot of money. I don't know if you know, it costs on average $2.1 billion to get a drug onto the market. So these studies can be very lengthy, costly, and very labor intensive, which is why all these companies decided to not deal with it. They would rather just go overseas and start using these products to treat patients. That's what's happening in Panama, Colombia, Mexico, the Bahamas. So people are going overseas to do these things because they don't have to deal with FDA and all the regulations. But from what I'm doing and what I'm teaching other doctors to do is the tissue that have not been altered. These are original cells that we call it native cells. So they haven't been altered in any way. So when you use those and to give it to another person to perform similar functions of what the cells were doing in the body before, then it's considered tissue transplantation. Any doctors can do it. So that's where that myth came from.
Oh, that's so interesting. It's incredible how we have misinformation that is just not explained properly. So having this information from you is really enlightening. So are you suggesting by what you said that using our own cells, our own stem cells is better than using, say, birth tissue stem cells?
No, not at all. Actually, that's my, big topic of education of the public. For what we're looking at with the current tissue sources, people are getting stem cells. Let's say we get it from our own body. We either get it from bone marrow or fat. These are the two biggest sources. There are other sources too. Some people get it from menstrual blood. You can get it from dental pulp, and there are all kinds of different sources. But these two are the most utilized and practiced. If you are getting cells from these sources, then these cells will be the same age as your current age. So whatever your age is, I don't care if you're 25 or 85, your cells are not as potent as the umbilical cord cells. So the umbilical cord, even though it was obtained on day 0 or day 1 of the baby's birth, it's younger than the baby's stem cells because these cells were trapped earlier in embryogenesis. So when the embryo is forming, these cells are getting trapped and they retain a lot of the characteristics of embryonic stem cells without the problem of causing tumors. So embryonic stem cells can generate these, disorganized growth called teratomas. But the umbilical cord stem cells, even though they are very young, very powerful, they have lost that, scary potential. So when you look at the potency of the cells, from how much anti-inflammatory factors they secrete, how much they're able to modulate the immune system, how neuroprotective they are, how many generations they have left, how far and wide they can differentiate, and how long their telomeres are. I mean, you can look at all these aspects, or how healthy their mitochondria is. Everything indicates that these stem cells, early stem cells, are superior. So these, if people are interested, they should go look at the study, look at the presentation I have on YouTube. It's called Are All MSCs Created Equal? I break them down very, methodically by presenting lots of studies, looking at these different factors. So that's a really important aspect to know that these cells are more potent, not only more potent, they're also safer because when you use your own stem cells, unfortunately, there's a tendency that your stem cells have lost certain kind of intelligence. So your stem cells could promote everything to grow, including cancer. So if you have some kind of, occult hidden cancer that people don't know about, right? That's how cancer starts. And the stem cells could be just telling everything to grow, including the cancer. And they actually shown that in a study when they put umbilical cord stem cells next to cancer cells versus putting fat-derived stem cells next to cancer cells. So when the fat-derived stem cells are, next to the cancer cells, either in a petri dish or on a live animal's body, in both cases, the cancer just keeps growing, getting bigger and bigger. But if you use umbilical cord-derived stem cells, the cancer just starts shrinking and go away. So this is why I feel there's an obligation for me to provide people with a treatment, not only that's more effective, and because the cells are more potent, but also safer.
Very interesting. Yeah, it's interesting how the details of the science of the intelligence of the cells needs to take precedence and not just the idea of stem cells as a generality. So thank you for that information. Do you use or have you ever used any aborted fetus stem cells?
Absolutely not. I don't know where to get it. It's not legal. I personally don't know any doctors in the US that's using that. So that is just, and people still ask me on YouTube, on social media, are you using aborted fetuses? I mean, it's so ludicrous. I don't know anybody that have access to it or trying to use it. Yeah, no, that's an absolute no.
Well, thank you so much. Well, that's a relief. I didn't think so, but I just thought for our audience, it's good to just convey that very important piece of information. So moving on, this whole world and science of stem cells, this very acute intelligence of our body pharmacology is fascinating. And with what you've said so far, would having more stem cells have a bigger efficacy for treatment?
If you're using actually native cells that have not been altered, there is a dose-response relationship. So the more you give, you could reach a higher clinical benefit up to a certain point, because there are studies conducted actually showing that, very high number of cells produce actually less benefit. So it's like their Goldilocks zone. There's an amount that works the best. So you don't want too much, even when they are native cells. But when you start to expand the cells, growing them into huge numbers, then there are all these potential things that could happen that I think people are not accounting for. Because you could, first of all, when you start to grow the cells have a tendency to they're under stress because they're outside of the human body. They're in some kind of incubator. So it's a stressful environment for them. Yes, they can grow, but they're growing in a sense to allow them to adapt to this culture medium that you just put them in. So they're the cells that are perfectly adapted to that kind of condition will survive and will divide. The cells that are not, really meant to be made, for that environment, they don't do as well. So then you get all these group of cells who are perfectly adapted to surviving outside of the human body. So it's not your own human body. Not only that they're adapted that way, they have changed. So the research I've shown, which is very concerning, I've gone to a lot of stem cell conferences, and that's what's presented, that these stem cells, even though you think they're still stem cells, maybe when you look at them under microscope, they look not that different, but they're no longer stem cells. They become daughter cells that have differentiated, that have gained a lot of different functions, characteristics, surface markers. So they're no longer the quintessential stem cells. And they're also expressing all these new surface markers that can mark them as foreign. And then you end up having higher potential for rejection, right? When you have expressed a donor's own surface markers, because when we use stem cells, one reason they're so helpful clinically is that they're able to adapt to the new person's body. And there are very little immune rejection happening, especially with mesenchymal stem cells. But when you start to multiply them, then they will just start to express, who they were before, instead of adapting to the human body. When cells are young, it's much easier for them to kind of work with the host and adapt and stay in the body. But when you make them older, they have a way of, be stuck in their own ways, so that's why when you use bone marrow transplant, the bone marrow stem cells, so these could be perfect match to the recipient. Even in those cases, there's no perfect match, right? They're checking 6 main HLA markers, but they're way more surface, HLA markers. I mean, our body's very complex. So you still have a high, a significant rate of rejection. But when you use umbilical cord blood stem cells, the umbilical cord blood composition is very similar to the bone marrow. So they're very similar as far as what kind of cells, it's all, right, the blood flows, it goes into the bone marrow. It's kind of one system. So the umbilical cord blood composition is very similar to the bone marrow's composition. But if you use umbilical cord blood transplantation without any kind of HLA matching, you don't match at all, there's way less rejection rate than a perfectly matched adult bone marrow transplant. So that shows you the power of young cells. So when you start to get older, when cells start to multiply in a culture, they get older, there's senescence, so they get more surface marker, expressed. There's just more chance for side effects. This is why I've heard people who go overseas and getting these, high amount of expanded cells, they actually can, upon each subsequent infusion, getting higher and higher degree of side effects, getting this tissue rejection type of side effects, fever, feeling really ill, very sick. So because you've altered the cells, just because you're giving people a lot of cells doesn't make it better. That's what I see clinically. I may give people, 1/5 the amount of cells as what's given overseas. Overseas, they talk about 200, 300 million, right? I give, 30 to 50 million. So I'm giving 1/10 the number of cells. I'm getting incredible results. When you start to expand the cells and change the characteristic of cells, and you think that you're still giving people the same stem cells, I think that's very misguided. And unfortunately, a lot of research were done on these expanded cells. So the dose calculation, general, 1 million per kilo body weight, that's based on these expanded cells. But clinically, what I see is that you can use much lower number of cells when the cells have not been altered.
Interesting. So yeah, it really does go to that age-old adage of quality versus quantity, especially
Absolutely.
When it comes to this kind of treatment. Thank you for that explanation. There's this also common belief I've heard as well that that there are no live cells in umbilical cord blood.
Oh, it's a common belief because there are some people and group of people that, there's agenda behind propagating that kind of belief, which is based on somebody's study, by obtaining stem cells, umbilical cord derived stem cells. So these are, it's really unfortunate. I really wish the field is not so ugly. It's ugly because there are some ugly people in it. There's no better way of saying this. There are people who are so vested in their current agenda, right? If they're doing certain type of stem cells, especially, I'm just going to say it out loud, a lot of the bone marrow derived stem cells, there are groups that are just very, very adamant that will be the best stem cell source. If you look at my presentation from the study around the world, it's really not my opinion. It's been shown that umbilical cord cells are the superior source, but I'm disrupting a whole business model, right? People are making millions and millions of dollars, whole organizations set up to use bone marrow derived stem cells, and doctors have invested lots of money getting the training, getting the equipment. Once you get the equipment and you get the training, then pretty much there's no more cost. There's barely any cost for the treatment. So the profit margin is very high. So who am I to come in and talk about umbilical cord stem cells, which made, all their equipment and all the extraction process, unnecessary, right? I don't need to put people through that. I don't need to get old stem cells out of their body and give it back to them, because, you're not only creating trauma for them, but the cells you just put in the body have a tendency to be attracted to trauma, and they will go right back to the disturbance you just made. And so you're recirculating old stem cells. So I'm showing people the possibilities, but because certain group of people see that as a threat, so they can obtain some stem cell vials from some companies. Not all companies are equal either. There are some companies that don't have very good product. This is why I founded my own stem cell company, Charo Biologics, because I want to make sure that people are actually getting what is promised. Our product had been third-party validated to have live stem cells. But you can't, and this is the crazy part, you can't talk about cells being alive, because if you talk about cells being alive, and that if we're using the metabolic activity of the stem cells, then somehow that makes it a drug. I'm still not understanding the rationale, but that's what the official statement is, right? So we can't talk about the stem cells, but yes, it's been validated. Cells are alive, high viability. After thawing, they're alive, and we've even done colony forming unit assay, CFU assay, which is putting these cells on a petri dish and allow them to multiply. So we can see a colony forming, which means the cells are alive and well and started forming more offsprings, right? So it's a definitive test that these cells are alive. But if somebody, with a different agenda decide to get some products, we don't know how the product was treated, how they were thawed, were they left on the counter for hours, like what was happening. And then, maybe some products are not good. So there's very few live cells. So then they post on their blog and it's, broadcasting that there's no live cells. And some people are very vocal and that sound very convincing. So a lot of people buy into it. So that's how the myth started. And because there's a purpose to the myth, right? It's beneficial. Just like when, overseas companies, labs will be very happy to say that stem cell therapy is illegal in the US. So everybody's flying out of the US to them to get treatment. Same thing here, that the people say, oh, there's no live cells in these umbilical cord birth tissue products. So then, then it's horrible, right? Why do them? Then go back to, the bone marrow, fat derived, So that's how that myth was started. And it's so ludicrous. So when people said, I heard there's no live cells. So how do you argue with a lie? Yes. All I can say, yes, there are. But they said, well, so-and-so said there's none. I said, well, but we have studies showing there are. So I don't know what else to say to you. So that's that's the lifestyle part.
My goodness. Yeah. So, I think in every industry, we have to contend with opposing agenda of differentiating, modus operandi of companies and people and scientists and doctors and professionals. And I think, you said it yourself that when we want to make paradigm shifts or create new systems of thought and therapies in the world, we have to have a disruptive agenda and we have to have a disruptive mind to be able to counteract these belief systems that are just blatantly untrue.
Yeah, so what I don't understand is how a person live with themselves if they come upon knowledge, knowing something else works better. But because their financial interest, they would rather give people subpar treatment. I just don't know that's not the way I operate in the world. I would ditch everything I had before and switch gear because this works better for people. That's the whole point. So to not open your mind up, some doctors, they don't even want to know. They don't want to hear it because whatever they're doing is working well. They're making lots of money and they've invested time and energy. This is it. This is what they're going to do. They don't want to hear any new information. So I saw that very clearly when I posted my video on LinkedIn a few years back, and I got attacked vehemently. And I was very respectful. I was telling, these people, please just watch my presentation and look at the evidence. It's really not my opinion. I'm just bringing to light all the research that's been done from all around the world. But no, they would rather attack than simply just look at the evidence.
At the end of the day, truth prevails. So hopefully that gives you more wind under your sails, Dr. Joy Kong.
Yeah, absolutely. And people are waking up, people understand. And I think the very smart patients, they've even seen some of the attacks, even on what I do. And they said, well, we can tell, that there's ulterior motive from the attacker. So we're not buying into that. Yeah. But some people do. Some people, get blinded by big words and very confident attitudes. That's okay. Everyone take their own path, but yeah, just be discerning. I hope people, be discerning, really get educated and not just hearing one person's opinion and then let that rule their decisions.
Well, that's why we're here. So how do you actually get your stem cells? Like, what is the whole process around getting your stem cells and then moving them into treatment?
Yeah, so that's the whole birth tissue processing, right? So it's a very elaborate process. We only accept donors from the US. So these are all women who have gone through regular prenatal screening, right? Visiting their doctor every month and checking all their infectious disease, all the, important markers. And so they're evaluated. These are young mothers under the age of 30, and they're all US based. We only accept tissue from elective C-section. So we don't accept vaginal birth. I think in the US now it's about 50-50, 50%. The mothers would just elect to do a C-section. With C-section, then you preserve the sterility of the field, right, as an operation. So there's no chance for the fetus to get in touch or, have contact with the vaginal canal, which is full of bacteria and microbes. So then you avoid that complication. So you obtain the birth tissue. When we know somebody is going for elective C-section, they're asked whether or not they want to save the cord for their own baby or they want to donate. And 90% of them will donate because it does cost a lot of money, a few $1,000s to, keep these tissue or cells in the bank, in the tissue bank. So they will donate it. And if they're willing to donate, then they're asked to fill out a very, very long questionnaire that will ask them about everything that could affect that cord. So their own health history, their own travel history, their work history, toxic exposure, family history, sexual history, of course, the prenatal history, partner's history. So they're asked, it's a very, very long questionnaire. We only accept people with perfect answers. And there's really no incentive for people to lie. Because in the US, you can't get compensated in any way by donating tissue. That will be considered selling human tissue. So they can't get compensated. There's really no incentive to lie. So after they donate, oh, by the way, so in my company, we only accept people who have not been vaccinated by COVID vaccine, because we do not want to introduce that level of complication. There's a lot of controversy, and we want to stay on the safe side. So that's another thing that's screened for. And once they are willing to donate, and it's an uneventful, healthy live birth, right? The baby's great, and so the cord is cut, and there are procurement companies. So they procure these tissue, and they will just put the placenta and umbilical cord into a bag and put it on ice and overnight ship it to the lab, and the lab will process it right away in the morning. So when they process, they also check for all these pathogens. They are adhering to the standards laid out by American Association of Tissue Banks. So the tissue transplantation is actually not under the governance of the FDA. It's regulated by AATB, American Association of Tissue Banks. So there are all these standards of what needs to be screened, HIV, syphilis, hepatitis and EBV, like a whole slew of pathogens but we also screen more. We go above and beyond, including, we screen for Lyme disease, prion, Chagas, and COVID. So we screen for everything. And if the tissue is positive for any of these pathogens, is tossed. It's not going to be used. This is one difference between stem cells obtained from birth tissue versus obtained in a doctor's office, with no clean room. I don't know any doctor's office that has a clean room. These are ISO 5, these are very specialized clean rooms, with, the suction of the air to remove any potential contamination. So these are processed in these clean rooms, but to make sure that there's no contamination after the cells are processed and they're frozen, then they're sent out to labs for sterility testing. That would take a couple of weeks because you want to make sure that nothing grows, right? They're actually going to thaw the cells and they're going to try to grow to see if there's any bacteria, anything bad that grows, or any endotoxins, toxins secreted by bacteria. It can be detected. So the results is going to take a few weeks to come back. So only after it comes back as completely negative, right, completely clean, that's when the tissue bank can actually provide this to doctors to utilize for treatment.
Wow, that's very extensive, preventative measures to make sure that the stem cells are completely potent and safe to use. So what is the process of receiving stem cell therapy at your clinic?
Whenever patients contact us and expressing interest, so we first send them a very detailed information, including, some of the questions I've answered, where this cell come from, what kind of things are screened, and, what other things are included in the treatment. So it answers a lot of questions. So I want them to be able to review everything before they consult with me. So when we do our consultation, which often is via, it's telemedicine consultation. They don't have to come to my clinic. So we can focus on them specifically, not on all these questions of where do you get the cells and, why does the cell help? So we can focus on what are you trying to get help from? And what is your specific, why did you have your condition? Do you, will stem cells help you specifically? And what kind of dosage should we use and where should we put it? So then we can focus on that. So in my clinic, so over the years, I've been doing stem cell therapy for over 7 years. And I've developed, gradually adding on more and more modalities because I realize, I've always known the human body is extremely complex. This is why I love stem cells, because stem cells are not a single chemical, right? It's not a single herb, which is a group of chemicals. These are live cells with DNA in them, is able to respond to your environment. So these are I call them little, intelligent pharmacies. So they go around your body and get to where they're needed to be and start to secrete all these important factors. They can, they can communicate via different ways. They can also, send mitochondria to your body, kind of rescue your cells. So there are various things they can do. They're holistic in that sense. They're very complex. They address many things all at once. But still, the body, it's made up of, all these incredible systems, and we're affected by, the amount of vitamins that we have, right? The deficiencies in the minerals, the amino acids, and, maybe there's toxicity involved, and maybe there's lack of hormones. So there are all these things. So I try to be as comprehensive as I can to optimize all these other factors, because the more I optimize them, the less frequently they're going to need treatment. So then I can really not only promote the best outcome, but also make the outcome longer lasting. So I teach them better way of taking care of their body, right? From their diet to, movement, moving their body, to detoxification, and to proper, nutritional intake. So I teach them those. So I've added elements where I can help them to enhance the blood perfusion, so better nutrient delivery and better oxygen delivery for their body, more ingredients for their body to build, like amino acids, minerals. And I give them supplement that can help mobilize stem cells out of the bone marrow, because when I give them these young, healthy cells, a lot of them have a tendency to go back to the bone marrow. That just, that's kind of home. So I can give them a supplement that mobilize them back out of the circulation. So they will keep, kind of, surveying and helping regenerate the body, because the more circulating stem cells you have in the body, that correlates with better outcome and better, faster recovery. So there are all these things. And I do ozone therapy right before stem cell treatment, because I can super oxygenate their body. I can activate their innate antioxidant system. It detoxify their body. It makes their red blood cells more flexible and to release oxygen more easily. It improves the mitochondria function. So there's and it modulates their immune system to make the immune system more balanced. So I combine that as well. And then I add peptides. Peptide is my new passion, because I realize, oh my God, these are fairly bioidentical signals that your body utilizes to promote all kinds of, regeneration and repair and just biological functions. So they decline as we age. But if we can get those specific signals out and give to people to target different things we want to, help with. For example, I can give them something to help their gut health, and give them something to really enhance their brain health, or things for, musculoskeletal repair, for immune boosting, for fat loss and muscle gain, for mitochondria health, for skin health. So so I can target. And that's the fun part, right? The art of it. So then when people come to me, we'll really sit down and talk about, what do you need? What are the things that you want to get better with? And then we can, have this very comprehensive program, because stem cells will give you the foundation, this overall regeneration. It will amplify everything else I'm going to do. But a lot of things are really important too, so you don't want to forget about them. So all together is going to do better. I'm less interested in which one is doing what than am I making the patient doing really well. So that's my goal. I really can't care less what is doing what, because sometimes 1 + 1 is 4, right? Just because one thing is doing something, another is doing something else. When you put them together, you could do way more than the two, just, side by side. They actually amplify each other. And the fact that stem cells is important can be kind of manifested. In this case, there's a doctor, he's a very well-known doctor with Lyme disease, and he's a hormone expert, peptide expert. So he's, one of the, major pioneers in functional and integrated medicine. And because he was trying to combat his own sickness, so he was utilizing all these modalities, but he still was not where he wanted to be. He was overweight. His cholesterol was very high in the 300s, and he had very little energy. Some days, barely could get out of bed by 2 p.m. So he did stem cells. What's fascinating was that was transformational. Quickly, his cholesterol went back to normal, and he got his energy back. He finally was able to go to the gym to work out, lost 30 pounds, and, incredible. Like, imagine, the kind of life, the difference that it's making, for somebody. So this is a super expert in all these other modalities, which are all important. But then once the stem cell came on board, and boom, transformational. So it's really important. So everything's important, but stem cells are really crucial.
Fascinating. It's really beautiful to see that the conversation around medicine is becoming integrative, and that each human being, even though we have the same basic blueprint, we're all very different. And the therapeutics and the ingredients and the technology that each one of us needs at different times has to be administered in an individual way. And the fact that you're addressing your patients as individuals is really is the most pioneering. And I see that's where medical science and humanity evolving into that kind of singular individuation as part of the whole collective. So thank you so much for this information today. I literally have so many questions I want to ask you, but we're short on time. So we're going to save it to the next time. Is there anything you want to share with us in closing for this really informative and magical segment today?
No, I think we covered some good grounds, cleared up some confusions. And I just think, we haven't even talked about the potential for anti-aging benefits, of stem cells, which is really exciting. I do have patients who come to me every 3 to 6 months to get an IV infusion, and you definitely have, see these in animal studies. Of course, it's hard to test for lifespan in humans. That's, the researcher would be dead by the time we finish the study. But for animals, you can definitely see extending animals' lifespan by 30%, pretty consistently. And then even when they give it to older animals at the human equivalent age of 75 years of age, it allows the animals to live much longer. So basically triple the time that they had remaining alive. So it's powerful. Not only tripling the time, they are looking amazing. They look young. Their locomotion is fantastic. Their brain function is really good. They do the maze really well. And so I just think if people want a better life, a healthier life, definitely look at, this potential. And you're definitely not going to get your anti-aging benefit by using your own stem cells. I'm sorry, that is just not going to work. You can temporarily treat certain conditions, allowing more stem cells to be out of the bone marrow, but you're not going to be doing regular extractions of your own bones, your stem cells, and putting back your body. You're just going to deplete your own stem cell supply. That's the truth, because every time when you take them out of the body and you put them back in, they will do their work, and most of them will die because you have woken them out of their dormancy, and then you're activating them. So they're going to work, and then they're going to go away. So you're just, depleting your own stem cell supply. So you have to use younger cells until better technology comes through. I'm still very open to any new technology. I know we're still at the infancy. So I'm constantly looking for new developments. But as far as, right now, the birth tissue derived stem cells is an amazing resource to help enhance people's life and help them live longer and better.
Thank you so much, Dr. Joy Kong. It's been fascinating as always.
Thank you, Chandanni. I really enjoyed our conversation.